Top Med Talk.
Welcome to Top Med Talk, the broadcasting arm of EBPOM, evidence-based perioperative medicine. I'm here to tell you super early bird registration ends on the 31st of January for EBPOM World Congress 2006. It takes place between the 7th and the 9th of July at the British Library in London. 3 days of evidence-based perioperative medicine, global insights, and expert debate featuring speakers including Michael Marmot and Ken Rockwood. Super early bird registration ends on the 31st of January. Register now at ebpom.org.
Hello and welcome to Top Med Talk. We're coming to you live from Anesthesiology 2025, the annual scientific meeting of the American Society of Anesthesiologists, here in Antonio in Texas. And we're having a great time so far. Andy Cumpstey, my co-host.
It's a great place, great venue, real nice buzz around the hall, and it's a massive hall, first thing to say. It's a huge exhibition space. I think any anesthesiology-related company you can mention seems to have a stand here. And it's a really, really good place to keep bumping into people. I think we forget how important sort of face-to-face aspects of these meetings are, but I keep bumping into people every break, session, every talk. There's someone you know from somewhere, and it's great to catch up with them.
If you want to find Australians, go to one of the coffee stalls. The Europeans are all around the freshly baked mini cupcake stall.
No comment.
No comment. Not there. Well, we better cut to the chase, Andy. We've got a fantastic guest, Ruthi Landau. Welcome to the podcast.
Thank you so much for having me. I'm Ruthi Landau. Most people know I'm originally from Switzerland. I trained there, and I came to the United States to do an obstetric anesthesia fellowship, which was a long time ago now. It was a 2-year fellowship. I was very fortunate to have the opportunity to do some research, which launched my career, which made me do a lot of interesting things and travel the world and visit you in Australia in 2012. And I am interested in anything that improves maternal health, from pregnancy, the comorbidities, patient safety, the patient's experience. We talk a lot now about pain during cesarean delivery, and it's just been a wonderful journey. I have been heavily involved in the Society for Obstetric Anesthesia and Perinatology as the president during the COVID pandemic, which was an experience in itself. And I'm now involved in the SOAP Centers of Excellence, which is what we talked about last year. And I more recently became the editor-in-chief of the International Journal of Obstetric Anesthesia, which I can say is probably the thing that I'm enjoying most doing right now. And maybe even one of the more enjoyable and rewarding things I've done, I would say definitely in the last couple of years. And I think that's why you wanted me to
come here. Congratulations, Ruthi. It's really good. And you're chairing a panel at this meeting about publishing. Can you tell us who's speaking and what they're going to be talking about?
So the panel is about writing, reviewing, and publishing manuscripts. The goal behind this panel is to encourage people to write the best papers possible, and for the reviewers to learn how to do a good job at reviewing, because we believe that as they become excellent reviewers, that will also help them become great authors. And then because we always want publications to be meaningful, pertinent, relevant, transformative, and produce evidence that can actually be implemented to ultimately not forget that we're doing this to improve patient outcomes. It's a long journey. And so we've done now several times these kinds of panels. We've done it through SOAP. We've done it through our own IJOA webinars. And the goal for Tuesday's panel is to have outstanding speakers. I'm so fortunate to have Brian Bateman, well known to many people, the current chair of the Department of Anesthesiology at Stanford and an editor within anesthesiology, present his portion of the panel, which is on how to write a paper, which obviously starts with how to design your study appropriately so that you can actually write a good paper. And then Cynthia Wong, who also does not need any introduction, the chair of the Department of Anesthesia in Iowa, who is also one of the editors of the Chestnut textbook that's coming out these days, the 7th edition. Cynthia will present on how to review a paper. She's also one of our handling editors in IJOA. And my goal, besides moderating this panel, is to wrap it up with how to make all this relevant for our readership and also for the authors to not embark on studies that either don't have the potential to change outcomes. I think it will be wonderful. I hope we have a strong audience and many questions. That was the goal, particularly in the landscape now where we're getting questions about funding, about how to conduct research, how to get the next generation to be interested in being part of, the enterprise of conducting research, writing papers, and seeing the opportunities where research doesn't necessarily mean that you need to conduct a very complex randomized controlled trial, but the many opportunities to author meaningful papers and get that to be recognized, to be published, and make a difference.
I'm sure it will be a fascinating session. For our listeners at home that can't attend in person, what are the key take-home messages on the author side first? What would you look for from the editor's side, from what the author should be writing in the papers?
So it boils down to having a defined question. You can't conduct a study if you don't know what you're looking for. So defining a question that is achievable in a study and having a hypothesis, having a primary outcome that is measurable, and obviously make it relevant. Some things can be measured but don't make a difference, and other things are very important but are difficult to measure. So it's finding the sweet spot and the balance between a wonderful question that can't be answered and something that can be measured but that doesn't make a difference. So I would say identifying a gap and designing the study that will allow the authors to get to the answer. And I think that we see more and more now in the research that we, in obstetric anesthesia, but elsewhere as well, is that finding the gap is not always that obvious. And we see either redundancies or things that don't make a difference. So we recommend doing scoping reviews. And I always urge our junior faculty or people interested in undertaking studies is look at the literature, what has been done, what has been answered, what hasn't been answered. And I think that we're starting to recognize more and more the value of these scoping reviews. I can give a specific example, and I just came out of giving a refresher course on anesthesia for cesarean deliveries, and there were many questions about the use of dexmedetomidine that has become now a little bit the new kid on the block. One of the reasons is that we need adjuvants to make patients not experience pain during cesarean delivery, and alpha-2 agonists have now emerged as being a very good tool. But it shouldn't be used in a way without, having some evidence as to when should it be given, how should it be given, what's the dose, who should receive it. And so there's been a little bit of an explosion of studies, and actually way more studies than we even expected. So undertaking a scoping review to see what has been published, and it has to follow the very robust recommendation following the PRISMA recommendations for scoping reviews. How are you going to find the articles? How are you going to identify the questions that you want to address within those papers and have a data sheet that allows you to look? And then how are you going to summarize this data? I think is something that should be taught and should be looked at. And if someone is thinking about conducting a study on looking at intrathecal dexmedetomidine, for example, doing a scoping review to see what has been done, what hasn't been done, the many gaps, particularly in that topic, is important. And I think this is what we need to do when we don't have much resources, we don't have much funding. So, going to the sort of board initially and identifying the gaps to design the best study possible and not venture in directions that are neither the right ones or don't allow us to identify what's the question that needs to be answered is what I would recommend.
Excellent advice. I completely agree. It's interesting, though, the time in these processes is often underestimated. And by its nature, a scoping review is looking backwards at what's been done before. And it can be quite hard for early career researchers planning ahead to sort of future-proof whatever they're about to start, their question or their study. And the scoping review gets done and what they're asking hasn't been done up to that point. And they then start investing the time to start that project and then find that somebody else has actually been working on it in another institution, another country, and comes in from the side. How do you future-proof against that problem?
Well, first of all, there could be many studies looking at the same problem. So even if others are interested in the same topic, I wouldn't be discouraged. But to your point of the time it takes, the effort it takes to look at the literature, I think if you haven't looked at the literature and you don't know what to look for and what the study needs to be, it is a waste of time as well. You will end up conducting a study that might never be published because it's not relevant or it's not pertinent. Obviously, there are resources to look at, is a study being done elsewhere? You can go on the clinical trials registries and identify whether someone else is doing something that is probably just about what you're about to do. I don't think that having two different centers look at something that might be very similar, you're probably validating, replicating, making it more generalizable if you have different institutions doing it, or coming to meetings and networking and talking to people, coming to sessions, looking at abstracts, looking is always important. But I see your point. It's difficult as an early career to finding mentors, mentorship, talking to editors. I see more and more. We get emails from people, well, not at this point of study design, but review articles. Is the journal interested in a review article? Is the journal interested in a scoping review or focused review? We get more and more emails, people reaching out directly, which I think is wonderful. We don't want them writing things that we will just flat reject if it's not the quality of publications we look for or not a topic of interest, or that someone else is just working on the same thing, exactly to your point. I think we need to communicate more. I think we need to be more judicious about what it is that we're going to spend our time, because, as I said, there's not that much time, less and less funding. Journals are more and more strict about their publications. So I think it requires more communication to avoid spending time doing something futile.
So let's move on to reviewing. So apart from, you get an email from a journal that's one you know and you trust, and they ask you to review something, you say yes. So that's the first step. Then once you've said yes, what should reviewers then think about when they're producing their reviews?
That is such a good question. I don't think we have enough time to go over everything, but I would say, first of all, most journals now have the responsibility to avoid a protracted review process. So I can tell you about many journals now reducing the time. For example, for IJOA, so the reviewer database is well known to us. We know who will review fast. We know who will make pertinent comments. And these people now get invited to join editorial boards. So for example, in IJOA, we've decided that anyone who is willing to review well, fast, and consistently gets invited to join the board. And then we give very clear instructions. So the instructions are respond to the invitation within 3 to 5 days. If you don't want to review or can't review, tell us right away. It takes one click of a button the moment they get an email. Then the review process, we've shortened the deadlines so that authors don't have to wait 3 months, 6 months. I've seen timelines that are not even really unreasonable. So there are seasoned reviewers who know how to review, and there are more junior reviewers who might not know how to review. We encourage now many panels, including here, including at SOAP, including in other meetings, where junior reviewers are invited to join workshops and other opportunities to learn how to review. We have a fellowship. It's on a call for application very soon. It's a 2-year program where we have workshops on how to review, and I'll tell you the points. We have webinars. We pair the junior reviewers with senior reviewers so they get to see how others reviewed. And we invite the reviewers as a learning opportunity, incentive, so that all this work that is behind the scenes that has never been recognized actually gets some output as well. We invite the reviewers to write editorials. I'm personally a big fan of editorials because I think a paper can be extremely well conducted and fit all the checkboxes of a well-designed study, but it lacks context. And so contextualizing, having someone else provide some context is always extremely helpful. So what do we want from reviewers? We want reviewers to really go big picture, like the checkboxes, the consort guidelines 2025 came out. Is this study registered appropriately? Actually, that's the work of the editor-in-chief, but I would say things we look at in a paper are the initial checkboxes. Is it registered, patient consented? Does it follow the guidelines? Is the question pertinent? Is the primary hypothesis well described? Is the study designed in a way that actually allows to answer the primary hypothesis and the primary outcome? Is the methods well described? In other words, and this is something that maybe some reviewers are not fully aware, but if the study cannot be replicable based on the method's description, there's a problem. Someone else should be able to repeat the study and hopefully find the same results. So the method's extremely important. And then the results, are they reported appropriately? Is the statistical analysis done appropriately? Are the tables and the figures supporting the findings? As an editor, I always look for tables and figures because I think they can describe 1,000 words of results. And then is the conclusion supported by the findings? We often have great studies, but then the conclusion suddenly jumped, 10 steps ahead. You did a great study. You didn't find this. Don't conclude this. You can have a good limitations section in our panel on Tuesday. We've done that several times. But I think, and I see that with the junior people who now learn how to review, there is a checklist and it's actually quite, I don't want to say easy, there's a learning curve, but it's easy to follow once you understand what the purpose is. And then, does it make a difference for our patients? I see sometimes studies that do seem to follow those things, but it's not something it's not relevant to the practice. It doesn't improve patients' outcomes. Or comparing two drugs with a very sort of well-designed randomized controlled trial, but those two drugs are not drugs that should be used. That's not a study that I, as an editor-in-chief, will accept to publish.
And I think it's important that people use a respectful tone and that they produce a certain volume of comments, because you don't want pages and pages, but you need a certain volume to be respectful of all of the effort that the authors have put into the work. Because even if we reject the paper, we want the authors to send their next work, which might be better, back to our journal. So it's a process that the reviewers are really helping the journal with, Ruthi.
This is so important. And as an editor-in-chief, I can tell you that I spend a lot of time on papers that we decide not to publish. And when we do a desk reject, which is not send them out for a review, I do the review and I explain why. And I might say, you can, if it's preliminary data or it's premature to publish, come back when you have that. I have never sent the generic templated rejection letter. I always explain why. And I always tell them, I hope this feedback is helpful for your future studies, or a sequel to this project. And the same thing with the reviews. So we spend a lot of time with reviewers. We meet, and I think there's a philosophy that really goes exactly with what you were saying, not to discourage the authors, but rather to provide constructive feedback, which is so important today because it might be the only opportunity some authors have. So our journal is international. Like most journals, we have a lot of international papers submitted, which we're encouraging. We've actually added section editors that are there to support low and middle income country publishing in our journal. So we really provide feedback, and we are inviting papers from all over the world, including a lot of copy editing, which comes from some of the reviewers, but definitely from the editors.
And just in the final few minutes, let's talk about publishing, Andy, how to make the papers that are published recognised and read.
Absolutely. I think we've just come from a session now looking at some papers that have been published this year. And it was interesting the way they were presented, and the publishing world is changing, isn't it? It's no longer all in print, it's all about online, and visual interpretations are important. And from your side, from the editor-in-chief's point of view, how is that sort of change affecting what you do with the journal?
A lot of things have changed. One of the things we try to do is, again, I think the editorials bring a perspective. There might be people who end up reading just an editorial, and sometimes the editorials bundle together a few papers on the same topic, which is something that we sometimes do. So this is one way. Another way is social media. The landscape of social media has changed a little bit because once upon a time, a lot of people were Twitter, now X, now a little bit less so. But we have, and like many journals, Instagram. One of the things we've launched is having our IJOA fellows summarize papers, actually contact the authors just to double check that the content is accurate and engage the authors. And we've done what we call now IJOA at a glance, which comes out once a week on Instagram. We started LinkedIn as well. And we've also started podcasts. So we were a little bit late to the game. I know other journals started before, but we're a small journal. But we've started doing podcasts, again, to engage the authors, sometimes the reviewers. We put them together. And we also amplify papers from other journals in our journal so that our readership can get a sense of important topics for obstetric anesthesia, since we are the only journal that only publishes obstetric anesthesia content.
Well, it's been great having you on our podcast, Ruthi. Always a pleasure. A friend to the podcast, I think we can say. Thanks for coming along too, Andy. It's been wonderful. So we'd like to say thank you to our sponsors. That's GE Healthcare and BD Advanced Patient Monitoring. We'd like you to look up our podcast on the web at our website, which is topmedtalk.com. We're on LinkedIn, we're on Instagram, we're on Facebook, we're on X, where else are we? Blue Sky. And all of this helps us bring our content free and open access to the world. Finally, we'd like to thank the American Society of Anesthesiologists for their generous welcome to the Congress. Cheers.
Top Med Talk.
Top Med Talk is the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. And this year, it's your chance to join clinicians from around the world at the EBPOM World Congress 2026 at the British Library in London. Between the 7th and the 9th of July, you will have 3 days of evidence-based perioperative medicine, global insights, and expert debate, featuring speakers including Michael Marmot and Ken Rockwood. It is the main event of the year in perioperative medicine. We want to see you there, and I'm excited to tell you, super early bird registration is still available all the way up until the 31st of January. Register now at ebpom.org.